First two parts. Part one, we talked about the what. Part two, we talked about the why for butt wink. Now, we're going to talk about some simple screens you can do on your own. You don't need a physical therapist, but you'll probably need some open space, a larger counterweight, somewhere in the range of 20 to 25 pounds, and it might help to video yourself so that you can replay the footage to get an idea for how your body's moving, or to send it to someone who has an eye for movement, and they can give you an idea of where to go from here. First screen is simply, we need to help the individual or yourself to understand what neutral feels like. And because I talked in the last video about the overextended athlete and how that can come into play in regards to butt wink and causing butt wink, we need to consider that maybe this individual just doesn't know what neutral feels like. Because of that, we simply take them through a flex position and an extended position. This is called cat camel in yoga. And I just actually did a video on discussing this as a warm-up for lifting specifically in the morning for spinal health. Comes from the likes of Stu McGill. But this is a very good drill to take someone through all the way to end range one way, all the way to end range the other way, and then right in the middle. And then basically you can tell them, or you can rewatch the video and say, all right, there's neutral. Now that I have neutral, can I go into my second assessment? In my next assessment, you're going to start with your knees a little bit wider than hip width, your toes tucked, and then I'm going to rock back as deep as I comfortably can. And if I can't rock back fully, then maybe I just need to change my stance width by widening my knees. For me, I'm a pretty narrow squatter, so normally I take my knees just right outside of my hips, and then I can rock back and hit almost rock bottom. From here, you can just simply walk your hands back and then push yourself up, and that's an easy way to get into a deep squat, just like that. But if you can't seem to get all the way back there, you kind of get stuck halfway, or you feel a pinching in the front of your hip, that could be a pretty good indication that now we're dealing with a genetic component, or we're dealing with a simple positioning component. Are we overextended again? So again, find neutral first. Once I found neutral, then I rock back. Third screen. We got to look at the ankles. Because if you don't have loose ankles, then your squat's going to resemble a good morning. I'm not going to call anybody out, but there are some individuals, very well known, whose squat looks like that, and they don't want to do anything about it. So, as such, it continues to look like a good morning when they might just want to address a few different components. But in order to screen the ankles, what you're going to do is you're going to find a wall or something flat in front of you. You're going to set up with your toes a fist width away. That's roughly, I don't know, 2 to 3 inches, something like that. From here, can I rock my knee forward, keep my heel down, and touch my knee to the pole, to the wall, whatever it is. Things you gotta watch for is, as I rock forward, do I lose the arch on my foot? If I do, then I know that I'm simply getting false dorsiflexion through the arch of the foot by dropping the navicular bone, essentially. It's called navicular drop. But if that's the case, simple fix. Pick up your toes, spread them out, lay them back down, then rock forward. It's called the windlass mechanism, the windlass effect. Other thing to watch for is, am I rotating the hip, and is the knee diving in as I push it forward? If this is the case, maybe we're dealing with some tight adductors, maybe we're just dealing with some tight calves. Either way, a couple of different ways that we can address that. We'll go into that in future videos. Fourth screen. Get your counterbalance. I'm going to use a 25-pound plate in this case. For this guy, you're going to want to set him up right in front of your body. Take your normal squat stance and then squat down as deep as comfortably possible. And then you're going to look on video or have someone watch you. And am I upright? How's my ankle mobility? And have I butt winked in the squat? If none of those are true, or I should say if my ankle mobility is fine, I haven't butt winked, and I don't feel any pinching in my hip, then I know it was simply a stability issue, core stability mainly, and when I give myself a counterbalance, it causes me to engage my core more, posteriorly tilt my pelvis just a little bit. Now I can get depth. So what do I know based upon that screen? Well, I know that I need to do more squat variations where the load is in front of the body, where I have an anterior load. Goblet squats would be a good one to start. And everybody says, oh, goblet squats are boring. Who wants to do those? All right, well, go find a real gym, one that has dumbbells above 100, and go do some goblet squats with a 150-pound dumbbell. I can guarantee you your upper back is going to get smoked from having to hold that dumbbell in position. And if you're doing them correctly, you're also going to get a really good quad stimulus, especially if you're having trouble with your back squat. Why? Well, because now you're that much more upright and you're able to maintain a good position in the squat. So, goblet squats may seem like this beginner exercise, but I've seen Olympic athletes using goblet squats, goblet squatting the 100-pound dumbbell, 4 sets of 20. It's definitely not a beginner exercise. It's a very, very useful progression that you can use to build into the proper squat. After goblet squats, you could move into something such as a safety bar squat, which is the bar that has the handles coming down in the front, or a front squat, both of which would be viable options and that are available at certain gyms. I won't say all gyms, but certain gyms. Front squat, definitely all gyms. But work through those progressions. Use these screens. If the ankles are tight, maybe I need to address those before squatting. If it's just a core stability issue, then I need to address that with the actual pattern that I'm using, go through proper progressions, and then work up to my back squat. But don't just think that you can do 1 or 2 activation drills or 1 or 2 stretches and go right back into the back squat and it'll magically fix itself. It's not how this works. It definitely takes time. But if you go through all 4 of those screens and you still say, I don't know, I feel like there's a pinch on one side, or I get this weird sort of hip pain. Well, if we've screened out all of the specific joints, and we know that we're still getting some sort of pain or some sort of movement dysfunction, your last chance, or I should say your last option then, is to go to a physical therapist and get them to run additional screens, or perhaps get some physical therapy treatment, dry needling, cupping, stim, cryotherapy, all of these sorts of different modalities, and see if that can help to correct the issue. Maybe we're just dealing with some inflammation because you've been squatting with a crappy movement pattern, and because of that, maybe you got a hip shift or something like that, and that just needs to heal over time, and then we can get back to squatting again. If you go through all that and you're like, dang, my hip still hurts, dude, maybe it's just your genetics and that's just the way your hips are and you can't, squat butt to ankles. All right, well, that's just the way the card's dealt out, but maybe you're just an awesome deadlifter and you're not that good at squatting. Pick and choose your battles. That's just what you got to deal with. But you just got to learn to accept it, train within that range of motion, and not beat up your hips simply because that's just not the way they're shaped. So, hope this series was informative. If you haven't watched 1 and 2, go back, start there, then run through these screens. But, anyways, guys, if you like the video, you know what to do. Subscribe below. Lots more content coming.